Post-operative care should focus on preventing infection, administering ophthalmic medications, pain relief, and client teaching for self-care at home. Monitor status of the eye dressing following surgery. Assess dressings for the presence of bleeding or drainage from the eye, as either could indicate a surgical complication. Maintain the eye patch or eye shield in place. The eye patch or shield helps prevent inadvertent injury to the operative site. Place the client in a semi-Fowler's or Fowler's position, having the client lie on the unaffected side. These positions reduce intraocular pressure in the affected eye. Assess the client and medicate or assist to avoid vomiting, coughing, sneezing, or straining as needed. These activities increase intraocular pressure. Assess comfort and medicate as necessary for complaints of an aching or scratchy sensation in the affected eye. Immediately report any complaint of sudden, sharp eye pain to the physician. An abrupt increase in or onset of eye pain may indicate hemorrhage or other ocular emergency requiring immediate intervention to preserve sight. Assess for potential surgical complications such as pain in or drainage from the affected eye, hemorrhage with blood in the anterior chamber of the eye, flashes of light, floaters, or the sensation of a curtain being drawn over the eye, which is an indicator of retinal detachment, cloudy appearance to the cornea, which is a sign of corneal edema, evidence of any of the manifestations or unusual complaints by the client should be reported to the physician at once. Early intervention is often necessary to preserve sight. Administer antibiotic, anti-inflammatory, and other systemic and eye medications as prescribed. Medications are prescribed post-operatively to prevent infection or inflammation of the operative site, maintain pupil constriction, and control intraocular pressure. Administer also antiemetic medication as needed. It is important to prevent vomiting to maintain normal intraocular pressures. Client teaching for self-care at home. For eye protection, to prevent the accidental rubbing and poking of the eye, the patient wears a protective eye patch for about first 24 hours after surgery, followed by eyeglasses worn during the day and an eye shield at night. Sunglasses should be worn while outdoors during the day because the eye is sensitive to light. The ophthalmologist will prescribe some eye drops and other medication to reduce inflammation, prevent infection, and in some cases, control eye pressure. Educate the patient how to administer the medication.
To administer the eye drops, firstly, wash your hands, then shake the bottle, take the cap off and tilt your head back about 45 degrees. If you can't do this, just lie flat on a bed. In one hand, grip the bottle firmly, and with a finger on the other hand, gently pull down your lower eyelid. Move the bottle until you can see the tip, but make sure the tip doesn't touch your eye. Gently squeeze the bottle until one drop falls into your eye. Close your eye and blink several times. Use a clean tissue to wipe away any excess drops from your face. Repeat this process for all eye drops.
Activities to avoid. Don't do any strenuous activities for a few weeks. Avoid lifting, pushing, or pulling objects heavier than 15 pounds. Don't drive, it is not safe because eye may still be sensitive to light. Do not wear eye makeup and consider avoiding face cream or lotion. To help prevent infections, do not swim or use a hot tub. Avoiding lying on the side of the affected eye the night after the surgery to avoid direct pressure that may dislodge the lens. Keep activity light like walking, reading, and watching television. Stay away from dusty areas as eyes will be sensitive to airborne allergens such as dust. Lastly, nurses should educate patients about the importance of keeping their follow-up appointments because monitoring a visual status and prompt intervention of post-operative complications enhance good vision outcome.